Dr. Yamini. I'm the head of department and senior consultant in the Department of Pediatric, Oncology, Hematology and Bone Marrow Transplant at the MBR Cancer Center, Kozhikode in Kerala. So I've been treating pediatric cancers since 2001. For the last 24 years, I've seen the problems associated with pediatric cancer as well as the long-term issues these families face. So I have known Sheba with Solace ever since its inception for the last 16 years. So to know the issues associated with a child diagnosed with cancer, you have to know the issues that are there in pediatric oncology. So when a child gets affected with cancer, these children can be treated only at specialized centers. So these are at long distances away from their home. That is the major issue associated with pediatric cancer. The second thing is that these are long-term treatments. Majority of the cancers have to be treated for around 2.5 years. The third issue is that all these children are immunosuppressed and have a lot of infections, so they have to have repeated admissions in the hospital, as well as they have to be near the facility that they are taking treatment with. So once we know these problems associated with this field, we'll know what are the issues. So the issues are: one, they have to translocate their family long distances to the treatment center. They have to stay there for long durations of time, like approximately a year. The third thing is that since they are immunosuppressed, they need a facility that gives them very little infection. So most of these public facilities wouldn't be suitable for them. They have to have some sort of a private facility with a single room where the family can be accommodated. And these also require multiple admissions due to infections. So the financial implications for a family whose child gets affected with cancer is huge. The other thing associated with this is most children need to be taken care of by their parents, the father as well as the mother. So the loss of job and the financial associations with that is also enormous. So these are the issues faced by these families with a child affected with a cancer as well as long-term illness. So Solace has helped us in a lot of ways for our department as well as for our children. The main, as I said, the financial help that Solace has given to many of our families during the time of crisis. When these families have long-term treatment, many of the time there comes a point when they find it difficult to manage their financial issues at a certain point. We have had lot of help from Solace is when we have social issues. Like we have had adolescent children who have had problems, reintegrating themselves with the society. So a great help has come from Solace Youth, who has helped these children to reintegrate into the society, find a little connect with the society, etc. So social help has also been enormous from Solace. Lot of NGOs are associated with cancers in India. So even at our center, a lot of NGOs take care of pediatric patients diagnosed at our facility. There are a lot of organizations actually doing social media support financially too. So what is different from Solace is that the identity of the child or the family is never revealed during the help that they provide us. The other thing is that they take care of the child as a family. So whatever issues that are there in the family is addressed by Solace, by the Solace volunteers. They even do home visits, to know the social aspects of the family, to know their living conditions, whether they can improve upon the living conditions. So I think it's a holistic support that Solace gives the family. I have known Sheba for the last 16 years, and the good thing about Sheba is she gets involved with each family. So any family that we refer to Solace actually takes care she takes care of them personally. So anything that happens to the family, Shiva would be the first person to know. So any event in the family, Shiva would be the person to know. So Shiva is a person who actually gets involved in any patient that we refer to her. So that is the peculiarity of Solace as well as Shiva against other organizations.